Dr. Fauci, Arkansas had 1,309 new cases yesterday. It currently has an explosion of cases. Does it surprise you to see Arkansas's rate at or near the top of the country?
You know, it does not. These types of things are entirely predictable. We know if you look at regions, be they states, cities, counties, that have a low level of vaccination, that's where we're seeing the increases in cases, which are leading to increases in hospitalizations, and unfortunately will lead in some cases to an increase in deaths. So it is not surprising when you have a higher level of community spread and a low level of vaccination that you are going to see the increase in cases that you're experiencing now in Arkansas.
What is the solution?
The solution is pretty clear. We know these vaccines work extremely well. They are highly effective in preventing infection and even more effective in preventing severe disease. So the solution to the problem, the solution to the challenge is crystal clear. Get as many people vaccinated as you possibly can, and you will see, as in other regions of the country, that the infection rate will not only plateau, it will drop dramatically.
Now, we have some areas are having travel restrictions. They're saying that if you're coming from Arkansas and you haven't been vaccinated, you need to show that you need to have a negative test, or you need to quarantine. I think Chicago has done that. Is that logical? Does that make sense?
Well, I'm not going to comment on the advisability of those types of restrictions. I will leave that to the local authority, but that's not unprecedented when you have situations where there are infections that are at a high rate in one location, that people have restrictions from going into other locations. But I will refrain from commenting on how advisable that is, because I will leave that to the local authorities.
Okay. There have been questions about when the vaccine will be approved for children 12 and under.
Well, we are doing and are in the process right now, even as we speak, of testing what's called an age de-escalation study, looking at the safety and the immunogenicity of the EUA-approved vaccines in people from 12 years old to 9, then from 9 down to 6 years old, then from 6 down to 2 years old, and then ultimately from 6 months to 2 years old. We are projecting that we'll have enough data by the end of the fall, early winter, as to whether or not these vaccines, which we totally anticipate they will be, safe and projected to be effective in children of all ages. Whether or not that ultimately gets approved is going to be a regulatory decision left up to the FDA.
Okay. And there have been questions about why the vaccine is still in emergency status and emergency approval, and when it's likely to get full approval, and why they're taking so long on that.
Well, that's a good question that's frequently asked, and it really requires an understanding of the complex nature of a full approval. The FDA has to dot all the I's and cross all the T's in the process of full approval. However, having said that, it should be pointed out that the volume of positive data showing the effectiveness in the real world setting of the vaccines, together with their safety, make it a situation that it is inevitable that these will be approved fully by the FDA. And it's really a matter of a technicality. So we should consider the EUAs as good as full approval because of the volume of very positive data that we have on these vaccines.
Frank, we have time for one more question.
Okay. What would you say to people that have been vaccinated, have the vaccinations, but they're worried about going out because so many people in Arkansas have not been vaccinated?
Well, you should feel that you have a high degree of protection if you are fully vaccinated. It would be obviously much better if the entire state of Arkansas had a high percentage of vaccines. But vaccinated people should feel appropriately that they are highly protected against getting infected and certainly against getting severe advanced disease.
Okay. Anything else I should have asked you that I haven't?
No, I think you covered it pretty well.
Doctor, thank you so much for your help and your time. I appreciate it.
My pleasure. Good to be with you.
Bye-bye.
Bye.